Hi, my name is Mark Sneddon and I'm the Operations Manager for Sync.MD. I'm here to walk you through a brief demo of the system's basic features and functionalities so that you can get an overview of how the system works and how you can use the SyncMD app to request and share your medical records. So let's go ahead and get started. As you can see on my phone screen, I've already installed the SyncMD app, but if you're looking to do so on your own phone, you'll either need to go to the Apple iOS App Store or the Google Play Store on an Android phone. So we're going to go ahead and open the App Store and we're going to search for SyncMD. And as you can see, we get a suggested result pop up here. And then we can see the SyncMD mobile health record app listed there with the white heart icon. To download the app, simply click on the cloud icon with a downward facing arrow, and that will install a copy on your phone. Once the app is installed, we can go ahead and register. That's going to take you through the normal user registration process, agreeing to an end user license agreement, verifying your phone number, and entering in your personal information for the account. For our purposes, though, we're going to go ahead and log into an existing account. We're going to log into my test user, Jane Doe. So this is what a new user will see when they're logging into the app. There'll be a link to the SyncMD website where they can get more detailed information, as you can see here on my computer screen. If they perhaps got referred to the app by another person and didn't view some of our promotional material. Here they could view the About Us section where they can watch videos and read information about how the SyncMD app works and why it's helpful. But for right now, let's go ahead and keep going through the process. So let's say that Jane Doe wants to request some records from her clinic. How does she do that? Well, she's simply going to click the Request from Your Clinic option. So right here, we're going to search for Evergreen Health, which is a healthcare organization near where I live. And let's say that I recently went to an urgent care center for some kind of injury that I might have had. Maybe I sprained my leg. So I'm going to scroll down here and see, here we go, Evergreen Health Primary Care Urgent. And I'm going to select that as the entity that I'm going to send my request to. I'll get a link to their website as well as an address for where they are so I can verify, make sure, all right, this is the right city, the right urgent care clinic. Great. Then I'm going to hit Create Request. As you can see, now the app is going to ask me, well, what kind of records would you like to request? We offer 3 different options. You can either request your pertinent record set. This is known as within the healthcare community as kind of a summary and up-to-date concise listing of your current health status, your allergies, current diagnoses, medications, basically what another doctor would need in order to get up to speed and be able to treat you in an informed manner. So that's what we normally recommend that users request, as your doctors don't need to see every 500 pages of your medical record. However, we also allow people to request specific records if they need to provide an explanation. Perhaps you only want imaging results or just immunization records. So we allow you to select those categories as well as entering in instructions for your doctor so that they can see exactly what you want to receive. Finally, we also allow people to request all of your records. However, we don't really recommend this because that could result in several hundreds of pages. It could be a very lengthy request, take a lot of time to process. So in general, we try to push people towards requesting either your pertinent record set to get that, concise summary, or to request specific records so that they know precisely what you want to receive. So in this case, I'm going to say I want my pertinent record set, and now it's going to ask me for the dates of service that I was seen. So let's say, I can't really remember. I'm able to select general timeframes, such as since my last visit, since the last month, since the last 6 months. I can select specific date ranges if I know, it was sometime between February and March. Or I can just say, I just want all the records from before a specific date. In this case, I'll say since my last visit, and I'll hit next. The next thing it's going to do is ask for the user to provide your driver's license for verification purposes. And so this information is provided to the healthcare organization that you're sending your request to so that they can verify your identity against their own records. This is necessary in order to provide the necessary assurances to those healthcare organizations that the patient you're claiming to be is in fact the patient they have on their records. In this case, it has saved my driver's license from when I first set up this account, but the normal user would see it blank and just be able to click Take Photo. In this case, I'm going to say retake photo, driver's license, and it's going to automatically open up my phone's camera in order to try to scan a driver's license. So I'll position my driver's license here on the table. I'll follow the on-screen instructions to move closer, and I'll hold it steady, and it will automatically take my driver's license picture. Now, as you can see, it provides me with some editing tools, so I can rotate it to be right side up, and I can adjust the borders so that it more clearly captures the edges of my driver's license. Once I'm done, I simply click Done, and it will attach the new driver's license picture into my account. Perfect. I can also tap to add an electronic signature, which is a required step. So here, I'm just going to clear, and as you can see, what shows up on the screen is simply what I'm dragging with my finger. So right now I'm simply dragging on my phone screen, as you can see. So users are able to sign electronically using their own fingers. So in this case, I'm going to say this was Jane Doe, and we'll say sign, and then we'll hit next. The next thing it's going to ask for is your address. Again, this is another information point for the healthcare organization to verify your identity, as address is one of the fields they can check within their own healthcare system. So in this case, I'm going to check, see that it's accurate. 123 Street Place, sounds normal. I'm going to hit preview, and then I'm going to see basically what the healthcare organization will be receiving electronically. In this case, they're going to get a cover page with information about SyncMD, as well as the relevant HIPAA and other governmental regulations that allow me as an individual to request my health record electronically through third-party apps like SyncMD. It's going to have information about my request, my demographic information, and then you can see here on the second page, it's going to have the authorization in which it provides the instructions, as well as my electronic signature and driver's license. You can see here at the top of the screen that there's a notice about a potential charge being charged by my medical provider. So some providers charge electronic fees for access to your medical record. Not every provider charges this, but in cases where SyncMD knows that the entity you're sending a request to is going to charge this $6.50 fee, we will collect that up front so that we can process that payment with that entity and reduce any delays in your request being processed. Otherwise, we don't want the entity to send back a notice saying, hey, you need to pay the fee first before we send this out to you. We want to make sure that we streamline the process as much as possible. If we don't know whether the organization is charging a fee, we won't collect one. However, they could charge you at a later date, whether by mail, email, or some other service. And as always, the full amount will be refunded in the event that your records are not returned within 30 days, which is the HIPAA limit time frame. And if there's another problem with your request, say they weren't able to receive or process it, there was some kind of error that prevented it being completed, that will automatically be refunded by SyncMD. So once I go through this information, review that it's all accurate, I'm going to go ahead and say check here to see that I've read and agreed with the form, and then I'm going to click proceed. In this case, I'm not going to do that because I selected an actual medical organization and I don't want to confuse their medical records department. So I'm going to go back here. And so when we said request from clinic, instead what I'm going to do is I'm going to say skip, I know the fax number. So this can be used either for doctors that perhaps aren't fully computerized, they may not be SyncMD release ready, or maybe they're still relying on paper records. So we offer the option to be able to enter the fax number manually. However, we do provide this instructions here where we warn individuals that in many cases, the fax numbers you're going to find on the websites of many of these healthcare organizations are their kind of business fax lines. And what you need to do is you need to find the medical records department fax number because that's often a different fax number and it's usually in a different part of the website. So you want to be careful before you enter something in because you don't want it going to the wrong place and then not receive a response. But let's assume either you've found a form which includes their medical records department fax number on it, or you've called the medical organization and asked for the fax number of the medical records department. So in this case, I'm going to put in a test fax number that I know is going to fail so it doesn't go to anyone in particular. And we'll say this is Dr. Smith. Oops, full caps there. So we'll hit next. And again, I'm going to kind of breeze through this process as I've kind of already explained. Identification, days of service, and then previewing our form here. As you can see, the header at the top is changed to reflect that we don't know whether this individual is charging a fee, and just warning you that they could send you a bill at a later date. I'm going to say, yes, I have read, verified, and agreed with that form. I'm going to send, and now SyncMD is processing that request in order to deliver it. So now that I hit done, I'll need to just refresh my app here to be able to show you that the new request has been created. So if we go here to record requests, we can see that Dr. Smith, that I have a electronic record of the form that I created and delivered to him. So I can see that here in full quality. I can zoom in and out. And I can also see an activity log. So I can see the history of what's been done with this request. So this will show activity by me, the user, by the entity that receives it. So I'll see a notice of when they uploaded a response. And then I can also forward by fax. So let's say, I kind of skip past that notice warning me about the right fax number, and I see, the fax failed. Okay, let me forward that to the correct number now that I've found it. So we do allow people to correct that. And we can also go back here to the top, and we can see that we can also see the sync log here, which provides another timeline of the user's history with things and requests that they have sent. So you can see here my request to Dr. Smith. Nobody has opened the request yet. Whereas here, down in some of these previous requests that I sent using this test account, we can see that a guest opened the account or nobody opened the link yet. So that's another way to see kind of a record of what's been going on with your account. Okay, so now what we need to do is figure out, all right, I as Jane Doe have sent out this request. Now, how does Dr. Smith access that? So let's go ahead so you can see this both in terms of what's on the request page and what the doctor would be doing. So I'm going to pull up this request form so that we can see kind of what Dr. Smith would be getting. And so they're going to see my authorization with this access code. So it's going to tell them to go to syncmd.com. And so that's what you see here on my computer. And it's going to say, hey, go to the have an access code page. And you're going to see it provides, again, some instructions here. So they don't necessarily need to have the form in front of them to be able to follow these instructions. We duplicate it on the website to make it as simple as possible. And it's going to say, enter the access code. So I'm going to copy over the 8-digit code from the app. So NEY3UPX5, that looks right. Then I'm going to enter in the date of birth for the patient. Again, this is a verification point. So in the event that the fax was, perhaps you entered in the wrong fax number and someone else has found your request, I'm just making sure that the person actually does have knowledge of you and personal information about you. So in this case, the date of birth is 10/28/1995. And we're going to hit next. So that's going to verify, A, that the access code was correct and that the date of birth was correct. And then it's going to provide me with access into the account. And in this case, it's going to ask me whether I want to register or whether I just want to continue as a guest. If I wanted to, I can insert my name so they can know who's been accessing the account. So in this case, we're going to say, I am John Smith, and I'm going to continue as a guest. So now what I'm seeing is Jane Doe's request that was sent to me. So we can see here, request to Dr. Smith. These blue boxes are kind of first-time instructions allowing guest users or new users some information on how the system works. So in this case, if I click on the request to Dr. Smith, I'm going to see the same thing that I see in Jane's account. The request that we created, as well as all that information that was included. So they can see the same thing. So maybe now they've either securely destroyed, or perhaps they filed away the original request form and they forgot, okay, hey, what records were they requesting? They're requesting their pertinent record set since the last visit. Perfect. I'll be able to pull that up for them. So how does someone, Dr. Smith, add the records into Jane Doe's account now that they're looking at it and working through the request? Well, it's very simple. They're just going to click on this Upload Documents button. And it works the same way that you would attach a file to an email. We're going to click here and we're going to say add documents from my computer. And as you can see here, it's going to pull up this page where I have this pathology report ready to go. I'm going to double click and it's going to bring that up into the SyncMD app. Um, Perfect. Very easy to do. I can click on this and you can see here's the electronic version of that document. I can rename it. So if I wanted to say pathology report from um, March 15th, I can do that. I can assign a tag such as lab results so that it can be categorized within the app. And when I'm done editing those details, I simply click Save Documents. Now the document has been saved into Jane Doe's account, and she will receive a text message notifying her that this new document has been added into the app um, and that she can check SyncMD to view it. In this case, you can see here, I can click on this. There's the document that we just added from our computer, ready to go. So what I'm going to do here is I'm going to refresh the SyncMD app so that we can go ahead and check that out before. Obviously, there's a delay in the text message delivery. The internet is much faster than standard cell coverage. So while we wait for that, I'm going to go ahead here. And as you can see, we've got some red documents lit up here, both in lab results, the category we assigned as Dr. Smith, and in all documents, showing that you have new document in both categories. So I'm going to click on lab results. And as you can see, boom, there's the lab result. I can fully zoom in as it's an electronic PDF. I can edit the title in case I, as an individual, go, you know what, the doctor gave it a very technical name. I'm going to change the title to be something I can more easily understand. I can do that. And I can also go here to my record request, and I can see the activity. And now I see the log. The request was open today, and then a document was added. So you're able to see the history of your request, how it's been processed, on top of the actual documents that are provided. So now let's say um, uh, I've left Dr. Smith's for another provider. I've moved states. So let's refresh here SyncMD. We're going to close that and reopen it. And we're going to go back to SyncMD. And we're going to take this from the perspective of, okay, now I'm Jane Doe walking into my new doctor's office. And he's trying to get my records updated. And he wants to know, all right, I need your most recent lab result. So if I'm Jane Doe and I go, you know what, I've got the SyncMD app. I got my records from my doctor. How can I share them with you? I simply ask my doctor to go to syncmd.com on his computer's web browser. You'll see this QR code on the front of the screen. And using Jane Doe's Share and Sync button, you can see here at the bottom of the screen, big and blue, I'm going to say Share and Sync. Provides a number of options for me to do that. And I'm going to say Sync with a computer nearby. And what that's going to do is it's going to open up my phone's camera, which will automatically scan a QR code on the SyncMD website. So I'm intentionally pointing it down so it doesn't automatically scan. I want you to see how it works. You can see that we provide instructions both on the website and the app. But as soon as I show it that QR code, it's going to go ahead and scan that, and it's going to provide access into my account. So as you can see here, let's call him Dr. Greg. Dr. Greg now has access to Jane Doe's account, and he can see the records that were added to her account. So I can see the original request to Dr. Smith, and then I can see the path report that he uploaded in response. So now I can check and go, great, perfect. I've got your blood work. I've got the diagnosis. I know what I need to know in order to be able to help you. That's just one way to share, though. That's in-person sharing through a QR code. Let's assume, though, that maybe I haven't moved to this new state yet. Maybe I want to share the records in advance of my visit. I can do that as well. So what I need to do here is, as Jane, I'm going to say Share and Sync, and I'm going to say Send as a link. And so what this is going to do is it's similar to the request. It's going to generate a unique 8-digit code that I can share with individuals to allow access into my health record. And they'll access that the same way in terms of the SyncMD website, going through the Have an Access Code link. So in this case, I would say, Dr. Greg, I want to share my full health record, and I'll say Get a link. As you can see, it's created a custom 8-digit code, different from the one associated with my request. and I can share that with whoever I need to. I can copy the text, so I can send it via text message. I could send it by email. I could call them on the phone and just say, "Hey, here's the 8-digit code. Go to syncmd.com/share, and you'll be able to access my account and see the records you need to." So that kind of covers a lot of the requesting process as well as the sharing process. So we provide a variety of different tools for people to be able to request records from their doctor, share records with their doctor. But let's say, for example, that you also have paper records. We can also scan those in using the SyncMD app. So if we click this blue plus sign above the Share and Sync button, we can add documents. We can get them from any computer. So let's say I'm not at the doctor's office, but I'm at home. I can scan that same QR code to get into my account and attach documents through the same upload process, similar to attaching emails, attaching files to your email. I can attach files. So if I have electronic copies on my computer already, I can get those into my own account using my own computer. I can also add photos from my library. So let's say maybe I took pictures of some documents when I was at a recent hospital visit, but I don't have the actual documents anymore. You can add in those photos, but you can also scan printed documents. So, similar to the driver's license, we can position the phone's camera above this document, and it will automatically scan that document and convert it into an electronic file. Now, obviously, because this is a scan of a physical object, the quality is not going to be as great as a native electronic file format. So, we do encourage people to always try to get the original electronic files if possible. But again, the quality is still pretty good, as you can see. You can still make out all of the text. And so, if you need to, you can still convert those paper files you may have that are really old and not stored electronically anywhere and make sure they're added to your record and available for your doctors and other physicians. As you can see, I just need to give it a name. So we'll say this is a path report. And once I click save, it'll upload the document. And now it's been added into my account. Perfect. Great. So I hope this information has been helpful in kind of showing you a brief demonstration of the SyncMD app, how it works, how you can use it to request, share, and add documents. And you can see its value in helping to coordinate care from a variety of different healthcare providers, users, and information. It really helps people make sure you're working with the most recent and up to date information. And so we encourage you to reach out and talk with us to learn more. We're always happy to talk and educate people about our system and the benefits. And I appreciate your time and have a great day. Bye.